gist with Adiola. And in today's topic, the last topic we discussed about stroke, and in today's topic we are going to be talking about miscarriage, spontaneous abortion. So, what is miscarriage? What are the causes, the signs and symptoms, the prevention and test, and what can be done to prevent miscarriage? So, let's dive right into the topic. So, what is miscarriage? Miscarriage or spontaneous abortion is a sudden termination of pregnancy which usually occur before 20 weeks of pregnancy, that is unexpected ending of a pregnancy in the first 20 weeks of gestation. So, what are types of miscarriage? Number one, we have complete miscarriage or complete abortion. This is a case where you've lost the pregnancy and the uterus is empty. There's no written product, there's no blood, nothing. You've experienced bleeding and passing and past fetal tissue. It can be confirmed from ultrasound scan. Here we have number two, which is incomplete miscarriage or abortion. You are bleeding, cramping and cervix has opened, bleeding has occurred and fetal tissue is out, and later the bleeding reduced and cervix closed and cramp and little blood is coming, and the ultrasound scan will confirm if there is incomplete miscarriage. If there is incomplete, if it is incomplete miscarriage, the ultrasound scan will show blood or there is particles remaining in the uterus. Then we have number three, recurrence miscarriage. This is consecutive miscarriage. It affects about 1% of couple. So this one is reoccurring. It's happening every now and then. So you have to go to the hospital and ask what is the cause. Let them do test and confirm what is the cause of this. Then we have number four, threatening miscarriage. In this case, your cervix stays closed, but you are bleeding and experiencing pelvic cramp. The pregnancy typically continues with no further issue. Bed rest and close monitoring with ultrasound is strongly advised. So, if you are experiencing threatening abortion, the fetus is doing well, the cervix is closed, but there is blood stain. Blood is coming maybe after a minor stress or no stress at all. So you have to be on complete bed rest at least for the first 12 weeks, and close monitoring with ultrasound scan is very important. Then we have inevitable abortion. You are bleeding, cramp and cervix have started to open, dilate. The fetal heart is normal, but cervix is open. There's nothing your pregnancy care provider can do. So in this case, the fetus is growing and all of a sudden there is cramping, there is dilation of the cervix, cervix is open and is not yet term. The baby is not yet term and there's nothing they can do. They will just allow the pregnancy to come out, and to also look for what is the root cause of the problem. Then we have blighted ovum. Blighted ovum occurs when there is at times there is cramp, there is pain and the cervix is open, the fetus is out and the gestational sac is still remaining. So on the ultrasound scan, the gestational sac is still there, but there's no fetus, there's no heartbeat, nothing is there. The thing is just empty. The gestational sac is just empty. there's no fetus, there's no heartbeat. So that is blighted ovum. And also we have missed abortion. This is a symptoms of miscarriage, but an ultrasound confirm that the fetus has no fetal heartbeat. So usually this occur from 8 weeks. By 8 weeks, the fetal heartbeat will show. We say fetal pole and the fetal heartbeat will show. So by 8 weeks up, we can confirm if there is a missed abortion or not. So by 8 weeks up, we can confirm if there is a missed abortion or not. The common signs and symptoms: vaginal bleeding that progresses from light to heavy. You may also pass graving gravish tissue or blood clots. Cramp and lower abdominal pain, usually worse than menstrual cramp. Low backache that may range from mild to severe. A decrease in pregnancy symptoms, nausea and vomiting. So those are the common signs and symptoms. Then what are the causes of miscarriage? Health condition: chronic disease like diabetes, thyroid disease, obesity can increase the risk of miscarriage. Infection like syphilis, Zika virus, cytomegalovirus can also increase the risk. Lifestyle: smoking, drinking, drinking alcohol and consuming high amount of caffeine can increase the risk of miscarriage. Uterine abnormalities, uterine abnormalities, structural abnormalities in the uterus like fibroid or congenital Mullerian anomalies. Environmental contaminants: exposure to lead, arsenic and organic solvent can increase the risk of miscarriage. Medication: some medication like misoprostol, retinoid, non-steroidal anti-inflammatory drugs can also increase the risk of miscarriage. Chromosomal anomalies: a fetus with extra or missing chromosomes may not develop properly, leading to miscarriage. Serious trauma: a serious injury like a car accident can damage a fetus and lead to miscarriage. In some cases, doctors can determine the cause of a miscarriage. Incompe ten t service: this incompe ten t service is a case where you are having recurring abortion and you have to go to the medical doctor or healthcare provider to help you check the service, if the service is too wide or if it's too short. Because if the pregnancy is getting to about 4 months, 5 months, 6 months and it's coming down, that means there's something more to it. So you have to see your medical doctor to confirm and check the service competent. Then we have the test and treatment. Ultrasound scan is most accurate, easy and doesn't have any side effect test to ascertain the miscarriage. The treatment: the health care provider will tell you the best treatment based on your condition, but there are three treatment options. Watch and wait for miscarriage to happen on its own. Medicine use of certain pills to make the miscarriage happen sooner. Suction procedure: have a medical doctor remove the pregnancy tissue using a simple office procedure called dilation and curettage, also known as D&C. So that is it on miscarriage. The purpose of this topic is to know types of miscarriage, so that when they just tell you that you have a miscarriage, you don't know the reason, maybe you don't know the meaning of what they are saying. So the most important thing is, after when you have done it in one place, try to confirm in one or two other places to be sure that it is what it is before you go further for a miscarriage. And also make sure you see your doctor to also discuss it with the doctor. Thank you and God bless you for watching today's episode. If you've watched to the end and you have not subscribed, please do well to subscribe, like and share till I see you in my next video. Thank you and God bless you. Bye.